If you have or are suspected to have endometriosis of the bowel, here's what you need to know when it comes to surgery. Now, it's never fun to hear about the risks involved with surgery, especially surgery of the bowel. We'd all love to leave our bowels in check and, if anything, have better functioning bowels post-op. But knowledge is power. I think it's important to know the risks so that you're informed when having conversations with your gynecologist about surgery, mainly referring to excision surgery here. It's wise to question your surgeon's experience with treating bowel endo and whether your surgery will require a colorectal specialist, because there are risks and complications. Let's delve in. Removal of bowel endo typically requires either a bowel shave, where superficial endo is found, so on the surface. A surgeon can separate the endometriotic lesion from the colon or rectum by cutting it off without having to cut into the organ. Or endo is removed via bowel resection. This is where endometriosis has penetrated the bowel wall. The surgeon cuts the affected part out and reconnects the healthy parts of the bowel back together. Endo that's developed inside the bowel can mean obstruction, potentially resulting in symptoms like abdominal pain, constipation, and bloating. Now, one of the main risks with bowel resection surgery is one that you're all probably aware of: the potential need for a temporary or permanent stoma. A stoma is an opening created in the tummy wall. A stoma bag is attached to the skin around the opening to collect feces, and it has its own associated complications, such as skin problems, leaks, retraction, and so on. Another potential complication is bowel fistula. This typically means that an abnormal connection has formed between the bowel and another organ following a bowel shave or segmental resection. And then you have post-operative bowel leaks, where bowel contents leak into the body. This could be due to the resection stitches not healing properly. It typically requires a second surgery and potential need for a temporary stoma while the bowel heals. Symptoms include fever, abdominal pain, nausea, and vomiting. Now, I know that's really full on so far, but I wanted to kind of give the top line, biggest risks associated with bowel surgery so that you're in the know and you can understand the importance of having someone specialized attend your surgery if they're going to operate on bowel endo. And last but by no means least, changes may be experienced with bowel function following resection surgery. Changes can include urgency or difficulty emptying your bowel. I don't know about you, but they seem to be quite normal symptoms as a woman with endometriosis. Anyway, it can take up to 8 weeks for bowel function to improve, though such changes may be more long-term. Be sure to keep your doctor informed. Not all bowel endo can be treated by the surgeons accessible to you. The last thing you want is for an inexperienced surgeon to touch your bowel. So please, I implore you, know who's undertaking your surgery and make sure you're informed of the risks involved.